You know that feeling when the holidays are over and you're just trying to get back into the swing of things? Well, for hospitals, it's the exact opposite of a slump. Today, we're going to pull back the curtain on a pretty intense logistical puzzle that kicks into high gear the second everyone else goes back to work.
Right, so while you and I are maybe easing back into our email inboxes, medical teams are gearing up for what is honestly one of their most demanding weeks of the entire year. Let's dive into the unique pressures they're under the moment that holiday break is over. All right, here's what we're going to cover. First, the surge itself. Then, the very first hurdle the team runs into. We'll look at how they manage the bottleneck that creates, the team that's under all this pressure, and finally, why this whole system actually works so well.
Okay, so picture this. It's the first Monday after New Year's. Every single elective surgery that was put on pause for the holidays, well, now they're all coming back. And they're all coming back at the same time. It's a tidal wave of scheduled procedures.
This is so much more than just a busy Monday. You know, professionals in the field, like certified anesthesiologist assistant Ariana Lyons, they have a name for it, a high-acuity Monday. And that phrase, high acuity, is really important. It doesn't just mean more patients, it means the cases themselves are often way more complex.
Now, what's so fascinating is how this immediately creates this massive logistical bottleneck. Think about it. All those procedures that were spread out are now squeezed into a single week. It's like a funnel, with everyone trying to get through the narrowest part at the exact same time.
With a schedule that's just jam-packed, you'd probably think the first major problem would pop up in the operating room, right? Well, actually, the first big challenge of the day often shows up before a single scalpel is even picked up.
And it all comes down to a super critical safety rule called NPO. It's Latin, nil per os, and it just means nothing by mouth. Patients have to fast before anesthesia, and it's to prevent a really dangerous complication. But you know, after a long holiday weekend, routines are totally shot, and it's surprisingly easy for a patient to just forget and have a cup of coffee.
So here's the crucial part. When that happens, the team doesn't just throw up their hands. Nope, they have a precise protocol they follow. The anesthesiologist assistant spots the issue, they huddle with the physician to assess the risk, and then they make a call, either delay the surgery or change the anesthesia plan on the fly to make sure that patient is completely safe.
So let's follow that pressure as it moves through the system. Once the surgeries are actually underway and all the operating rooms are full, the focus shifts. It's no longer just about getting started, it's about what happens on the back end, in the recovery room.
Yeah, with all the ORs running at full tilt, the post-anesthesia care unit, the PACU, becomes the next critical point. The flow of the entire hospital for the rest of the day really depends on getting patients out of the operating room and into recovery smoothly and safely.
And to handle that, the Anesthesia Care Team has these three really clever strategies. They use drugs that wear off faster, so patients wake up quicker. They use a mix of different pain meds to cut down on side effects that could keep a patient in the hospital longer. And they're constantly triaging, moving the most stable patients out first to free up those critical beds. It's a real work of art, coordination-wise.
So how on earth does all this come together without, sacrificing safety? Well, the secret is actually built right into the structure of the team itself.
It's called the Anesthesia Care Team model, or ACT, and it's pretty much designed for exactly these kinds of high-pressure days. You have skilled professionals, like certified anesthesiologist assistants, working with an anesthesiologist. What this means is that every single patient gets a provider whose only job is to focus on them and their stability. And this quote from Ariana Lyons just nails the whole mindset. She says that even when the number of cases goes through the roof, the level of vigilance and the precision of the care, those things stay the absolute top priorities. The standard of care simply does not change. So, after seeing all this in action, what's the big takeaway? What does it all really mean? Well, it's this. What might look like pure chaos from the outside is actually a finely tuned machine doing exactly what it was built to do. This crazy catch-up schedule, it isn't a crisis. It's the very scenario the Anesthesia Care Team model was designed to handle perfectly. It's just an incredible display of expertise and coordination. And it really makes you think, doesn't it? What other complex systems, what other dedicated and basically invisible teams are out there right now, working behind the scenes in our lives just to make sure everything runs the way it's supposed to? It's definitely some food for thought.